Hello everybody. Now you're seeing here is a question paper of MBBS First Professional Exam of Human Anatomy, Paper 1. This question paper is for MBBS 2019 admitted batch under this university RUHS, that is Rajasthan University of Health Sciences. This is a big university. There are around 14 to 15 government medical colleges affiliated to this university, and let me start reading them fast. So there are SMS Sawai Medical College Jaipur, RUHS Medical College Jaipur, then Jawaharlal Nehru Medical College Ajmer, RNT, that's Rabindranath Tagore Medical College Udaipur, GMC Dungarpur, GMC Bharatpur, Sardar Patel Medical College Bikaner, Dr. Sampurnanand Medical College SNMC Jodhpur, GMC Kota, and then Barmer Medical College Barmer, then GMC Jhalawar, Rajmata Vijaya Sindhya Medical College Bhilwara. Then you have PDU Pandit Deen Dayal Upadhyay Medical College Churu, GMC Pali, and GMC Sikar. So there are around 15 government medical colleges affiliated to this university, and the same date, that is 23rd of February 2021, there was a common exam for all these students admitted under this university 2019 admitted batch. So this was question paper 1, and now let's see the marks distribution here. In this university, it's like 100 mark question paper. Out of that, they had objective section A, and that section A includes 6 marks for fill in the blanks and only 4 MCQs. So there are 10 marks objective paper, and that's section A. So it's this section A that I'm going to solve it for you. Okay, let's see what are the questions. Section A, this fill in the blank is number 1 is red nucleus is situated at the level of midbrain. So at what level of midbrain you will find is red nucleus? It's an easy one, but actually not very clearly precise question. So you can fill here superior colliculus, of course. Superior colliculus is one thing. Then you can also mention that oculomotor nuclear complex. So both the fill in the blanks, both of them are correct. If you write superior colliculus or oculomotor nuclear complex, they are at the same level. Where you find is red nucleus. Question number 1B is nerve injury leads to wrist drop. Now this you have to be very precise in writing. Actually just writing answer of course is radial nerve, but the better way of writing is that radial nerve injury above the elbow. This will be a better answer, right? Because for complete wrist drop, there should be paralysis of all the extensors, and they're taking origin from the posterior aspect of the lateral epicondyle of humerus. And if there is injury of deep branch of radial nerve, that is in the back of forearm, that also is called posterior interosseous nerve. So what will happen? There will be finger drop, right? Because these extensor carpi radialis longus, right? So that is spared. And the extensors, the digits, that is extensor digitorum, that is mainly innervated by this posterior interosseous nerve in the back of forearm. So remember that wrist drop, when they'll talk, you will answer that radial nerve above the elbow, and when they talk injury of radial nerve below the lateral epicondyle or in the back of forearm, then it will be finger drop. Then next question is the length of auditory tube in adult person is. This question has been asked in Uttarakhand University. there also it was MCQ rather on this. So the length is 36 millimeters. You should know this. Out of this 36 millimeter, remember the central bony portion is 1/3, and the outer bony outer 2/3, that is towards the pharynx, that is cartilaginous. So it is like 12 and 24, right? 12 is bony portion towards the middle ear, and 24 millimeter is cartilaginous portion towards the pharynx. And at the same point, just remember that external auditory meatus, right? So external auditory meatus was 24 millimeter. And in external auditory meatus, what was the distribution of bony and cartilaginous portion? So remember, in external auditory meatus, the central portion, that is towards the middle ear, that is bony, and the peripheral towards the pinna, that is, or the external auditory meatus, that is cartilaginous. So here it will be 1/3 lateral or peripheral is cartilaginous, 2/3 portion is central, that is bony, and the distribution here again will be 8 and 16. So 8 cartilaginous peripheral and 16 bony central. So both of these questions are very common. So remember these measurements. Then question is about hyoid bone develops from, hyoid bone develops from second and third arches. So second arch actually contributes to the upper half of the body and the lesser cornua, and the lower portion of the body and the greater cornua are being formed by this third pharyngeal arch. And the skeletal derivatives of the second pharyngeal arch also are stapes, styloid process, stylohyoid ligament as well, right? And third, of course, contributes only this much portion of the hyoid bone. Then nasolacrimal duct opens into the anteroinferior part of inferior nasal meatus. Inferior meatus of the nose, anteriorly, you will find is the opening of nasolacrimal duct, and there it has a valve, and that is called valve of Hassner. Okay. Then Broca's area is located in which gyrus? So Broca's area is located in which gyrus? Remember, there was the central sulcus, then precentral sulcus, and this precentral gyrus, postcentral gyrus. Now there it was like divided into 3 gyrus. This is superior frontal gyrus, this is middle frontal gyrus, this is inferior frontal gyrus. So inferior frontal gyrus is the answer you can write. But at this point, remember, this point is the Sylvian point. And what was happening here at the Sylvian point? There was the stem of lateral sulcus. This was dividing in an anterior ascending, this anterior horizontal, and the posterior ramus. So here this was this dividing this stem of lateral sulcus, and remember there was these portions separated out. This was pars opercularis, this was pars triangularis, pars orbitalis. So it is actually pars triangularis and pars opercularis. That is area number, that is this area we are talking is pars triangularis and pars orbitalis, area number 44 and 45. So this is found in the inferior frontal gyrus overlying pars triangularis, pars opercularis, Broca's area. This you can write inferior frontal gyrus. So that was about the fill in the blanks. Then MCQs, lowest projection of ligamentum denticulatum lies at which level of spinal nerves? T9 to T10, between T9 and T10, between T12 and L1, between S2 and S3, between S4 and S5. So short revision about this ligamentum denticulatum thing. Remember there was this foramen magnum here, foramen magnum, and that was continuing with the vertebral canal. So let's presume that this is the vertebral canal and this is the foramen magnum. Here will be the, this is the spinal cord, right? So let's presume that this is the spinal cord, or you can consider that this is reaching up to the lower border of L1, right? So this is the spinal cord, and then I'll approximate it to the spinal cord will be this meninges. Which meninge? This is pia mater. So if they ask like what emerges from foramen magnum, what will you say, spinal cord or medulla? So remember, it's medulla oblongata that emerges out of the foramen magnum. But what is spinal cord? That is like from the upper level of C1 vertebrae. Now, and you know that there is an outer, on the outside, of course, there will be this arachnoid. Of course, there will be arachnoid also, but remember that arachnoid will not terminate at L1, rather it will continue out at till S2. So this is arachnoid matter, and then outside to that will be dura mater. So dura mater and arachnoid mater together, they continue down at lower border of S2 vertebral level. So this was the meninges. And what was happening with this pia mater? Remember, pia mater, this level is very important, and that is L1. This is L1. So spinal cord terminates at L1 lower border, L1 lower border, right? So from here it continues down as phylum terminale till the coccyx, tip of the coccyx. Okay, so this phylum terminale has both, like intra meningeal portion and extra meningeal portion as well. Now in this, the portion here, like we'll say that from C1 upper border is the spinal cord beginning and it terminating at the lower border of L1. That is the extent of spinal cord in the vertebral canal. Now there was, there are like how many spinal nerves, by the way? You have 31 spinal nerves, right? And how many vertebrae you have is 33 vertebrae developmentally. And how many ligamentum denticulatum you have is 21 pair, right? 31 pair is the spinal nerve. The spinal nerves are 31 pair, ligamentum denticulatum is 21 pairs. So the first pair of ligamentum denticulatum, remember, and these are modifications of pia mater. So modifications of pia mater, you have two. One is the ligamentum denticulatum, another is phylum terminale. So this first pair of ligamentum denticulatum, remember that it is at the level of foramen magnum. An important thing about this is that if you are seeing this, this diagram, what you're seeing is let's say from behind, like you're seeing from behind, so you will find that this vertebral artery enters the cranium anterior to the first pair of ligamentum denticulatum, and the spinal accessory nerve enters the cranium behind to this ligamentum denticulatum. Then of course there will be spinal nerves coming out from each, these spinal nerves, the pattern of exit is between these spinal nerves from C1 to C7. These spinal nerves emerge from above to their corresponding vertebral levels. Then C8 emerges from below C7 cervical vertebrae, and then T1 to coccygeal nerve. All these spinal nerve, thoracic, lumbar and sacral nerves, all of them, they will emerge from below to the corresponding vertebral level, but they'll emerging out from the intervertebral foramen. Now these spinal, these ligamentum denticulatum, they will be present between each such spinal nerves like this. These are the tooth-like processes given out from the pia mater laterally, and they merge or blend with the dura mater of this vertebral canal like this, right? I'm not counting them, I'm not drawing it very much symmetrical. So just keep remembering there will be spinal nerves emerging. So what happens is the last of it, this ligamentum denticulatum, it actually does not fuses with the dura mater of the surrounding, what happens is this last pair, what they have asked is the last pair of ligamentum denticulatum descends and blends with the phylum terminale. So, and this, they have asked is about the spinal nerves. So these are the spinal nerves emerging from between these ligamentum denticulatum. And what they have, remember that L1, like lower border of L1, which intervertebral foramen will be here, by the way. Here actually, this what you're seeing is conus medullaris, like the tapering of the spinal cord. So, but the spinal nerves are destined to emerge out from below to their corresponding vertebral levels, and that's why the spinal nerves coming out from conus medullaris, they descend down and then they gradually emerge out from their corresponding vertebral level, and that forms the cauda equina diagonal. So if spinal cord terminates L1 lower border, right? So which nerve emerges from L1 lower border? It will be, right, L1 spinal nerve, because it is arising below the L1 vertebrae. So L1 spinal nerve, and above to that will be T12 spinal nerve. So remember that T12 and L1. This is the last pair of ligamentum denticulatum that is emerging between T12 and L1 spinal nerves, like because they have the spinal nerve actually has to reach out through this intervertebral foramen. However, there are many nerves emerging from conus medullaris, but they will all descend down and will emerge from the corresponding vertebral level, and thus forming a cauda equina. So got it now? What they have talked about is the last pair of ligamentum denticulatum, and you got to know the answer. So the answer will be, what will be the answer here? Yes, so the answer will be this T12L1. Lowest projection of ligamentum denticulatum lies at which level of spinal nerves? Answer is T12L1. The next question is, rotator cuff is formed by all the muscles except supraspinatus, infraspinatus, teres major and subscapularis. This one again is an easy question. So you're seeing is humerus from above, right? So this is humerus from above. Cut section here is the glenoid fossa, and this is the scapula, right? And if what you're seeing is the right humerus from above, so what you'll find anterior to the lesser tubercle is this muscle subscapularis. Then you have supraspinatus, and then you have infraspinatus, and you have is teres minor, right? So these are the four muscles which form the rotator cuff. Remember, there was another exam, because this was I'm uploading is for your preparation for your further exams. So what will happen, like you should actually check out the question papers from other universities also. So similarly, there was a question in some another university, and that was about like which of the muscles of the rotator cuff is not involved in the rotation of the humerus. So there was this answer, remember, that supraspinatus actually is not involved in the rotation of humerus, rather it's for the initiation of abduction. The rest muscle subscapularis is for medial rotation, and infra and teres minor, infraspinatus minor for the lateral rotators. So here you've seen that teres major is not a part of rotator cuff. Okay, so the question answer here, that rotator cuff is formed by all except, your answer will be teres major. Okay. The next question here is, recurrent laryngeal nerve supplies all muscles except posterior cricoarytenoid, then you have oblique arytenoids, then you have lateral arytenoids, then you have cricothyroid. So remember that recurrent laryngeal nerve actually is the nerve of 6th pharyngeal arch, right? And what is the nerve of 4th pharyngeal arch? It is external laryngeal nerve. So all the muscles, or interesting, all the muscles of the larynx, there are, derived from all muscles of larynx are developing from 6th pharyngeal arch, and the nerve supply is by recurrent laryngeal nerve, except is cricothyroid is from 4th arch, and what will be the nerve supply is external laryngeal nerve supplies this muscle. So the answer here will be cricothyroid. Okay, next question is, which of the following air sinuses is first to develop? So remember that maxillary sinus is the first to develop. One point is first to develop. Okay, and the other important point it is that it's the largest air sinus. Both of them are important. Okay, so it's done.